my mom, who's like a perfect case. Same thing with her tongue. So like I clean her tongue with airflow and then I laser her tongue. She's not a tobacco smoker anymore, but she vapes now. She quit smoking. She quote unquote quit smoking. She sucks on that vape everywhere.
Oh yeah.
It's like she
It's
smokes
worse.
more
Yeah.
than, sorry mom, if you're watching this, because I know you watch all my stuff. I love you so deeply. But it hurts my heart when it's like attached to your hip.
Yeah.
What's up, dental peeps? It's your girl Irene here with Tooth or Dare podcast. Hold on to your suction. It's about to get slippery.
This episode of the Tooth or Dare podcast is brought to you by our friends at Philips Sonicare. Thank you for helping dental professionals elevate oral care with your partnership and dedication. Philips Sonicare offers comprehensive oral care solutions catering to the entirety of our patients' needs. To achieve a healthier oral environment for your patients and provide them with a more radiant smile, Philips Sonicare provides an array of products designed to optimize their oral hygiene regimen. These offerings are meticulously crafted to ensure optimum efficiency, allowing clinicians to tailor their brushing experiences accordingly to their specific patient needs and requirements, whether it be teeth whitening, enhanced plaque removal, or overall gum health. Sonicare electric toothbrushes harness an impressive technology boasting 62,000 brush head movements per minute. This innovative approach gently pulses water between the teeth, effectively dislodging plaque and facilitating its removal. Backed by over a century of healthcare expertise, Philips Sonicare instills confidence in users, and it's consistently helping us clinicians get the results we desire. For more information about Philips Sonicare products, please visit the link in the caption below. Welcome back to another episode of the Tooth or Dare podcast, peeps with your peep Irene and the Honorable
Vic.
Welcome back to Op Talk edition, answering questions from the pin post on my Instagram. What are we doing today?
Today, our topic is laser.
Okay, laser. Big topic. What was the question?
The question is, recently started doing laser. A lot of people ask, how long does it last? I tell them it decreases the bacterial load for up to 8 weeks. Obviously, it comes back, but what's your layman's terms for what you tell your patients?
I love that. What does the science say? So we were doing a little bit of research on this before. And what does science tell us? The
range is like 6 to 8 weeks is kind of peak
bacterial reduction.
Yeah.
Got it. So it's not that it doesn't last. I think that's the preconceived notion, is that you're going to do laser and it has this it's only going to be good for X amount of time. It's going to neutralize negative bacteria and allow us to have optimal healing, repopulate with good bacteria. It's not that it can't last forever, but if the bad habits continue and we haven't changed the habits and we haven't changed the oral flora, then that's when we start to see refractory perio, refractory gingivitis, and we see those symptoms start to return. So this is what I say to patients. So the layman's terms is that we get optimal healing over the next 6 to 8 weeks, which is why I want to see patients between 4 to 6 weeks afterwards. So I'm intervening at the peak to be able to ensure that we're removing all of the biofilm, we're taking care of our mouths, we're being more intentional with our home care, and that we are allowing the laser to continue to have its good effects. Otherwise, in 8 weeks for now, it's going to run out its time of doing the best that it can do. And then all of those other elements and effects are going to come back into play. Yeah. So it's not that it doesn't last. It's that it requires us to change habits. It's kind of, I sometimes compare it to plastic surgery.
Right.
That, you can get certain things done. Yeah. But if you, say lipo, for example, so you're getting liposuction done. But if you don't change your habits, you may gain weight afterwards.
Absolutely, yeah.
So these are very similar things that have not similar effects, but they have a similar time frame that we need to really consider what we're changing afterwards. Is there anything else that science told us?
A recent study told us that the group that had laser had an average of 1.77 millimeter pocket
What was the
reduction.
What was the conclusion statement?
The conclusion statement is, as adjunctive to SRP, diode laser assisted non-surgical therapy of periodontitis has significantly improved clinical parameters of plaque index and bleeding on probing, and has significantly reduced the clinical attachment loss and periodontal pocket depth compared to the controlled group after 1 year of follow-up.
That's cool.
Yeah.
So they took a group. How many participants were in the study?
160.
Okay, so the 160 people, they broke them up into 2 groups, and one group was SRP alone, other group was SRP laser, and the SRP laser group over 12 months showed a significantly improved reduction in bleeding points, plaque index, and plaque scores. And I love that it evaluated them over 12 months.
Yes.
Did they say anything at all in that study about home care? Like, did they change any of the methods of removing plaque at home?
They did not.
So they were just leaving people with whatever habits that they had, which I think is also good because
I think so too.
It doesn't influence any change based on like changing habits at home. So that's a really interesting thing.
Yeah. And it significantly reduced the periodontal pathogens.
Yeah.
Yeah.
They took samples. I remember this study. So they took samples of the biofilm and they evaluated the samples of the biofilm to see what the pathogens were. So it had a significant long-term effect on the oral flora as well. I can say that I have some patients that are perpetually going to be on laser. One who I saw last week, she's a mouth breather. She's had ortho twice. She was a premolar extraction case as a child. She's relapsed. She has a lingual wire that does literally nothing. It's so thin and flimsy, and the teeth have shifted around it. So she has lingual inclination of the molars and premolars, and now she's got this lingual wire that's just like harboring bacteria. But she gets laser at every appointment in order to manage the biofilm, in order to manage bleeding, and she's got localized pockets that will forever be 4s and 5s just because of the way that the teeth have shifted.
Yeah.
She has one premolar that's so far lingual that the other 2 teeth are almost touching, and it's like lingual inclined. So that I said lingual, like how many times did I say lingual in that sentence?
A lot.
That lingual is just like such a tough spot for her to clean.
Yeah.
So we had a conversation that in order for us to maintain a healthy mouth, like you have to do all of these things at home, but also we may have to continue to do laser. So on her file, there's a pop-up that says add an extra 2 units of time to each appointment in order for her to have, for us to have enough time for her to always get laser treatment.
And that's why you have to be so intuitive and so up to date with what the parameters are of what you should be recommending, because you can't just have one protocol and you do it for everybody. You do need to change it up or depending on the patient.
Yeah. But you have to understand how it works in order to be able to create those protocols.
Exactly.
I think that, people go to a laser course, they do a course and then it just becomes like, well, I'm only going to use it at SRP because that's really where it's indicated the most and focused on social media the most. But it has a place in maintenance appointments. It has a place in pediatric appointments. I have a patient who suffers from halitosis. She has a dry mouth and she is a constantly coated mouth. We use the laser on her tongue. And in order to help with she has a very hairy tongue.
Right.
She's constantly coated. So I physically take a piece of gauze and I fluff her tongue out and then use the laser in the crevices of her tongue.
That's smart. Yeah.
And coupled with probiotics, but we do that at her maintenance appointment in order for us to really try and take care of the biofilm on her tongue.
Have you ever done it in heavy smokers? Do you do it in your heavy smoking?
She's also a smoker.
Yeah. Okay.
Yeah. She's also a smoker. Yeah. And my mom, who's a perfect case. She's on all of my implant maintenance stuff, but she also has a very wide tongue. I believe she has sleep apnea, but she's refuses. Same thing with her tongue. So I clean her tongue with airflow and then I laser her tongue.
Yeah.
She's not a tobacco smoker anymore, but she vapes now. She quit smoking. She quote unquote quit smoking. She sucks on that vape everywhere.
Oh yeah.
She
it's
smokes
worse.
more.
Yeah.
Then sorry, Mom, if you're watching this, because I know you watch all my stuff. I love you so deeply, but it hurts my heart when it's attached to your hip.
Yeah. And it was designed to help people quit smoking, but you're right. You do it more because it's more convenient. You don't have to go outside.
It doesn't smell.
Yeah.
I think she probably gets more nicotine from it than she did from cigarettes.
Yeah.
My dad still smokes, on the other hand.
So does mine.
That's another story, another battle.
Yeah.
But
Yeah.
that's the
Anyway.
anyway. Smoking cessation should be a topic
Yeah.
that we talk about, because that
Yeah.
So that's the patient terminology, is that
Yeah.
in some cases you may forever need this adjunctive therapy as part of your everyday dental hygiene treatment. And in some cases, you can change your habits at home to better improve your home care, which will help the results of using a laser last for longer. I think that people should be using hydrogen peroxide products at home and rinsing with hydrogen peroxide products. I was mind blown last week that I still had a patient who was using an alcohol-based mouthwash. I was like, wait a minute. I looked at the file, like, how long have I been seeing her for? 3 years I had been seeing her. And I don't know how I never asked that question. So I was like, what are you rinsing with at home? And she's like, oh, I use Listerine. And I'm like, okay, well, what kind of Listerine? And she's like, I don't know, the one that really burns. I love that feeling. And I'm
So
like,
many people
and
love
I'm
it.
like, that's not a good feeling.
I don't get it.
You should not. She's like, the yellow one. I'm like, the yellow OG one is like arguably the worst one to use for drying of tissues. And so
probably acidity levels. And anyway,
I think there's some science, and we should do a science piece about acidity and uptake, because I understand why some products are acidic in order for it to uptake into the tooth faster. So everyone's really up in arms about acidity on certain rinses, but sometimes the mechanism of action needs to be more acidic in order for it to have a more therapeutic effect.
For sure.
Argument for another day on acidity. But did we satisfy that question?
I think we did.
Perfect.
Yes.
Short and sweet episodes. I love these. All right, everyone. Thanks again for tuning in to another episode of the Tooth or Dare podcast. If you have questions, head over to my Instagram, Toothlife.Irene, and ask them away in the pinned post. All of the resources are available for downloads. And, until next time, peace out, papes.
Peace.
Bye.